And when you say, it doesn't work, I'm really
Hmm.
interested in that concept,
Yeah.
because sometimes when people go to the doctor, it's not always clear, especially when they tell you like this might take a while to get,
Yes.
really get going, and
Yeah.
you've been dealing with the pain, which means you're kind of
Yeah.
used to it to a
Yeah. Yeah.
certain
Yeah.
amount, and you don't know what to expect, like if you're
Yeah.
expecting too much. So,
Hmm.
what went through your mind as far as like translating, okay, I don't think it's working versus maybe getting stuck where some people might get stuck at like, I guess this is as good as it gets. What was that kind of
Yeah.
conversation that
That's
you
a good
guys had where
question.
you were,
So Dr. Onajan told me if we get to 50 or 60% of a pain relief, that is good for you. And we did. We got beyond. And that's how we knew that treatment was working. And once we got beyond one course of a treatment, she's like, we're going to go to the next one. And that's how we went from 50 to 60 to 70 to 80.
reduction in pain?
Mm-hmm.
Wow.
Yep, absolutely.
It's amazing. So
Mm-hmm.
she was basing it on your specific
Absolutely.
percentage of pain.
Mm-hmm.
That's really interesting.
Yeah.
So when it comes to other things, so the pain is kind of subjective,
Yeah.
based on what you're experiencing in your body. Then you
Mm-hmm.
mentioned like the drainage and things like that.
Mm-hmm.
What were some of kind of the ways that you gauged that, and did it meet your expectations, go beyond your expectations?
Yeah. It did. I will say, in addition to the treatment, we did have to do procedures to remove some skin, which I was extremely nervous about. I think, in anything related to a lot of scar tissue, your confidence just kind of, especially, for a woman, it just goes down, right? But Dr. Najan was very patient with me, so that has helped tremendously too, getting rid of a lot of scar tissue. So, um, in addition to the treatment plans, the medications, the dieting, and the procedures that we've had, a combination of all of those, it helped across the board with the drainage, the pain, and it wasn't overnight, it took some time, but with the beginning of the treatment, I started to see a reduction of the drainage like immediately. And she kind of let me know like, it's working, but we still have to get rid of the tissue, the damaged skin tissue. And I thought, do we really?" Like, the medication is working, but that too, on top of, became like, "Oh my goodness, I feel even better," once it was healed, of course. So, it's just like a combination of things that played a part in what you see over time.